Good morning. My name is Dr. Jennifer Klemp. I'm a professor of medicine in the Division of Medical Oncology at the University of Kansas Cancer Center. I'm excited to share with you Leadership Reinvented, Lessons from Dr. Seuss. And I will not be reading from this detailed text to you this morning. However, there are some good lessons learned. And as we go through our disclosures, you can see the very last one that I am not related to. I have no financial ties to or political opinions regarding Dr. Seuss. However, I am going to share with you today my own opinions, experiences, and research over the past 25 years. Today, we'll review very quickly kind of stages for opportunity and leadership for women in medicine, common barriers and opportunities for professional growth. How do we implement some of these strategies and really dismantle some of the barriers in our way? And what are some resources that I have found useful? So when we first started, and I don't know how many of you got this book, I got it first when I graduated from high school. And Oh, the Places You'll Go was full of promise. I would go to college, then postgraduate school, and then have multiple opportunities in medicine. I would find a great life partner and a best friend. If you wanted kids, you could have kids and a career, and your hard work would be fairly rewarded. You could do it all. But oh, the places you actually go. Well, there's many twists and turns along the way. School and training may not have one one-way street, but maybe a multi-lane highway. My heart has been broken not just once, but multiple times. If you do choose to have children, that's a very critical life choice. It's very important, it's a life goal, but it does have an impact on your career. There is not a clear path to promotion, and hard work is not always the main ingredient. So can you do it all? Well, I'm not sure. It feels like something has to give, and that will vary along the way. So I don't mean to end in that kind of intro on a negative, but I want to talk a little bit about how we got here. So why do we have the opportunities or not that we have today? And how do we maximize those and really grow in our professional leadership, whether we're in medicine, in nursing, and in allied health or other type of medical profession, administration? You know, we have a lot of opportunities, and it really starts from what I like to call a generational effect. And those are things that happened from our mothers, our grandmothers, our aunties, you name it, women in previous generations who didn't have those same opportunities. And I'm not sure what type of influence you had in your life, or if it was a teacher or a mentor or a family member. But, you know, when I grew up, I remember my mother telling me, you know, that you needed to be independent, that you needed to have an education, that you couldn't be dependent on anyone because you never know if there's always going to be someone else, you know, sort of in your life. So the important part was to make sure that education, make sure that goals, make sure that opportunities were really maximized with high levels of expectation. And part of the reason for that is that many women in previous generations didn't have those opportunities. Some of them obviously became teachers or nurses, many of whom still do that today, but other growth opportunities were pretty limited. I think it's fascinating that if you look back at history, what year do you think women could actually even apply for their own credit card? Well, that was 1974. And if you think about not being able to have your own credit card without your husband signing off on it, that meant you couldn't build credit. You couldn't have that independence that we all sort of take for granted today. I think the other important piece of gaining this independence is that we were pushed so energetically because of those lacks of opportunity. And when you think about these expanded opportunities, they were tethered with bolstered expectations. So a high level of achievement, a high level of expectation, partially because those opportunities were not there for women in previous generations. So not only are we honoring those women through our hard work, but we are also appreciating the efforts every step along the way. So I think it's also an important thing to think about that as we look at these expanded opportunities, we have to remember that many women, even in the workforce today, are still timid about taking those chances. And it's interesting because I know a lot of you've probably read the book Lean In by Sheryl Sandberg. And she talks a lot about how women won't apply for a job unless they feel like they meet like 100% of the qualifications, whereas a man will apply for the same job with only 60% of those qualifications met. More recently, because it was really kind of hard to substantiate where that data came from, LinkedIn has actually done a larger study looking at kind of those same variables. And the interesting thing is that they found that there was similar sort of discrepancy in the number of jobs that women would apply for. And actually, it's quite a bit less. So if we think about how many job opportunities may fit, but we don't necessarily see that ideal fit, then a lot of times we don't take that chance. But if women did take the chance, 3 out of 4 times, they were actually the ones who got that job. So I think that the interesting part is what is holding us back and what is going to push us forward in sort of taking those next steps. So I think this is all sort of part of how we sort of define our goals and work towards our goals. But we first need to reflect and respect sort of how we got here and how we are able to even be in on the field to make these types of choices. So our current challenges, obviously based on the opportunities and expectations that we have, a lot of it plays into equity or lack thereof, both gender, race, and I think in regards to those 2 topics of gender and race, we have pay, we have the job opportunities, we have promotion, and we have finding mentorship that all sort of feed into those kind of key variables that we have under race and gender. So I want to kind of list off for you a little bit of statistics, not a lot, but in the past 25 years, at least 40% of all students in medical school have been women. And more recently, and in the past year, this was the first time we saw more women actually in medical school than men. But only 34% of all physicians in the US actually are women. So yes, there's opportunities in regards to education, but what's happening after that does have a discrepancy. We also know that that then translates into leadership in that less than 18%, really less than about 20% of hospital CEOs are women, less than about 15 to 20% of deans or division directors are women. And when it comes to like senior authors and sharing our research, it's about 10% that are women. So we tend to see that this opportunity is even though women are in the educational field, we are getting those advanced degrees, we're not filling those positions of leadership, we're not filling the job opportunities that are available to us. And we know that women still earn 20 to 30% less than men. So how do we start bridging that pay equity issue? So not only do we have pay and opportunity, but then it also prevents us from promotion, whether that be into a leadership position, whether that be in academics. And then how do we hopefully find some mentors to help us with this journey? And if you recall, we all want to have a mentor or someone to help guide us through this journey, sort of a navigator. But how do we find that? So myself, being someone who is just about ready to turn 50, it's interesting because 2 of my first mentors are both physicians at the University of Kansas Medical Center. One has recently retired, but those 2 women were 2 of 3 women in their medical school class. And when you hear their stories, it's very interesting and very you just can't imagine women having to go through what they went through back in the late 60s, early 70s. So they graduated medical school in 1972, the same year I was born, and their experience obviously is very different. And they were very dominant mentors in the sense that they wanted you to experience everything. So it was more of that immersion mentorship experience. We don't have really the opportunity for that anymore. And we'll talk a little bit more about how we find that. But putting that into context, where in the past, when you were a mentee or you looked to that person as your mentor, you really had the ability to learn from their day-to-day. I went with them all to meetings, to clinic, every part of their day you were able to experience. And I think through that, you were really able to have that full immersion that just isn't possible anymore. So how do we sort of modernize our opportunities for mentorship? I think this is a very telling kind of quote, that you will come to a place where the streets are not marked. Some windows are lighted, but mostly they're dark. A place you could sprain both your elbow and chin. Do you dare to stay out? Do you dare to go in? How much can you lose? How much can you win? And so as we think about sort of these roads less traveled, or the dark room, and do you go in, it really gives us some of the next steps we need to be a successful leader. How do we develop persuasion, motivation, negotiation, networking, and stay focused, all within sort of this political monster that's the clinic we work in, the organization that we work in, the society that we live in. And I thought this was a funny figure that went along with it, the meetings you'll go to, because I think that one thing we've all realized is that the more we grow in leadership, the more time we spend in meetings. And how many meetings could actually be done in 15 minutes, but they're drug out for an hour? So we'll circle back to that. But the important part is, how do we start making that list of skills and matching it up to what we have and what's missing, so that we know how to grow and enhance our leadership skills? So let's take that down another level. And what does that really entail as we start building those skills? Well, it means we want the ability to be able to take risks, and calculated risks, and also sometimes sort of not uncalculated risks. It means we have to have the ability to actually listen. How many times have you been in a meeting and it feels like someone's just checking a box? They really don't want our feedback. They're just sharing a perspective, and they don't want the feedback. They just want to say that they've, shared this amongst the group. And the most effective leaders are actually excellent listeners, and listen way more than they talk. We want to identify and recruit key personnel or team members. And how do you know if that's the person to take the chance on? And do you hire based on the skill someone has, or do you hire someone based on a little bit of the skill, but the right amount of personality and trainability? What's that perfect ratio? How are we looking out for opportunities? Who's coming to us? Are we open to opportunities that may be out of our scope and out of our comfort zone? Are we able to make some of those hard decisions and really do what's best for the organization and for the patients and for whatever our goals are? Do we have an enthusiastic attitude that enables us to pull people in, to empower them, to establish trust, to be compassionate, to show just enough vulnerability that it's going to motivate that creative process that may be different from our own? And we have to respect each individual's kind of creative process, but still focusing on the goals at hand. And sometimes that's hard because we're redirecting people, because sometimes we can get a little bit distracted. And when we start talking about medical leadership, if I ran the circus, it would be a whole different ballgame, right? But do you want to run the circus? Or which part of the circus would you like to be part of? And so I think that that's another opportunity that we have in medicine, is it more resources and building teams? Is it in nursing or as a physician leader? How are you going to be key and really pivotal in some of those key decisions? Because I think one thing that we know about medical decision-making is there's a lot of power in medical decision-making, and it's based on a lot of education, it's based on evidence, and it's based on really changing those outcomes. So if we want to implement change, do we have the skills necessary, or do we need to sort of sharpen our tools when it comes to quality improvement or enhanced workflows? Do we need to know a little bit more about business planning and sort of the business side of medicine. And I think everyone who works in medicine needs to have a clinical cap, a business cap, and maybe even some sort of a hybrid cap that really helps us understand what's happening from each of those vantage points, because it does impact us day to day, even though you may not think that it impacts your day to day. How do we really invest in the future? And that's, I think, where mentorship comes in as well, is that if we're not thinking about the next generation, if we're not investing the time, we're not going to have the same level of engagement that we had growing up in medicine, or maybe you didn't have and you wished you had. And so how do we compensate for that? So we have to invest in the future, not only with human capital, but with ideas and research, with the ability to really make our care have the reach that we want it to, whether that's community engagement, physician engagement, nursing engagement, healthcare provider engagement, you name it. We have to figure out how and what are the best priorities for investing in the future of not only cancer care delivery, but obviously the organizational structures that we will work within. And then how do you balance that with research? Because as any of you know who do clinical research, it's a very hard balancing act. And if you're a good clinician, it's hard to be a good researcher and vice versa. So how do we build this balance? How do we build, the scientific team and do team medicine, both in clinical care and in research? So these are also priorities, I think, of medical leadership. But one of the cores that we have to kind of keep hold is, the places you won't go. And that really ties back to your integrity, which your integrity is who you are. It makes us face our fears. And I think one of the most interesting parts about fear is there's a lot of things that go into fear. And we'll talk a little bit more about that in a slide or two. But if we're not able to acknowledge and own our limitations and our fear, we're not going to be able to sort of take those next steps. We're always going to be hesitant. We're always going to be cautious. It's really hard to stand up for what's right. There's a lot of people who are very intimidating. There's a lot of meetings where you're the only woman. And so you don't want to be looked at as, the angry woman at the table. So how do we make sure that our tone delivers confidence, yet doesn't come off as being aggressive? And so I think the interesting part is you could have a man and a woman sitting right next to each other, delivering the same message the same way, and the woman's going to come off and be interpreted much more harshly than the man. So there are different rules in the rule book, whether we want them to be or not, and no matter what we do, those inherent biases are there. And so we have to acknowledge them, know they exist, and be able to sort of pivot ourselves to make sure that we're meeting the needs of the group and we know the audience that we're talking to accomplish the goal at hand. And that also requires a level of transparency. And I have always found that transparency, whether it's through conflict of interest reporting, whether it's through really being honest and open with collaborators and partners, you have to have a level of transparency in order to build trust. Because at the end of the day, we all want to move forward. And I think that the more we try to sort of put things behind the curtain, or we try to not involve other pieces that could influence our ability or our decision-making, it makes it more complicated down the road. So I think the more transparent you can be in a very calculated and thoughtful way, the better you will be at the end of the day. And so your integrity is really what you have. And so you need to make sure that you're investing in your integrity and you're protecting your integrity. So there's lots of distractions, right? You're going down the race. If you think about it from a traveling standpoint, there's off ramps, there's yields, there's construction, there's all sorts of things happening. So how do we stay the course? Well, there's also a lot of unnecessary drama. So the first thing is you cannot get sucked in by someone else's drama. Yes, you want to be empathetic. And as we talk about mentoring and peer support, you want to be that peer to help your colleagues process, to really help be part of that thoughtful sort of thinking through a situation, but you can't be pulled into unnecessary drama. You need to limit back channeling, because back channeling may feel more effective, but ultimately it is not an effective long-term tool. It's a very sidebar tool. And yes, we do it in clinic because someone's there and we need to sidebar about a case. But when we start getting into leadership positions, the more sidebarring, the more back channeling that happens, the less transparent the process is. And people really don't respond well to that. We also know that we want to be inclusive. And so we try to sway kind of our audience. You're not going to sway everyone, and that's okay too. There's a reason we have differing opinions. There's a reason we have, kind of collaborative teams. It's because we aren't all going to agree. But what we need to be able to do is have respectful conversations about the topic at hand. What can we agree on? And maybe break it into smaller pieces, starting with the things we can agree upon. And so we need to be able to have open and honest and respectful conversations. We also need to remember sometimes when the scope is so large and we get so excited about something, and I am inherently known for big picture, but then how do we take that scope and narrow it down to what's tangible? And so that's where maybe your tactic is whiteboarding. And so you want to put up, here's our ultimate goal. And how do we want to get there? And so you're going to take it down and take it down and take it down so you have a stepwise process of how you're going to achieve those goals. So the important part is big picture thinking is huge. It's important. It is vital in a leader, but you can't get distracted by the big picture and not have a good deployment, a good way of delegating, or really splicing that up into that stepwise process. And the hardest thing for many of us, including myself, is how and when do we say no? An opportunity comes our way, we don't want to turn it down because will that opportunity come again? So calculating when and how to say no is very hard. And I don't have a right recipe for it. And early in a career, we say, we sometimes want to say no because we have so many competing things. Maybe you have small children at home, you're trying to run your household, which of course, women still do 30% of more of household tasks. All these types of things are happening, but yet that's the time when you're building your career versus when you're older in your career. I want to turf things down to some of our younger faculty or some of the individuals that I mentor. So it's really hard to know sometimes when to say no, but we need to for our own sanity, as well as making sure we're prioritizing the things that are most important. So what's holding us back? Well, little Cindy Lou obviously was held back by the Grinch until she wasn't, because she won him over, right? So she used some of those tactics like persuasion, consensus building, and really was able to turn the tables on a situation that started out pretty negative for she and her community. So think about, if you feel like Cindy Lou, what are the things that are happening in our world? Well, we know there's unconscious bias, and that's something that happens. All of us have it. It is inevitable. And the key is learning how to acknowledge it and learning when it's kind of impacting our thoughts or our decisions, as well as how do we acknowledge that to other people. So there's a way to do it. And part of it, what's happening, I think, in our culture today is that we're very accusatory, and we're very much like, something happened, you write it, it's a cancel culture. We're writing them off because of that. But I think they're also teachable moments. So I think we need to kind of take a step back, think about how we communicate something that maybe that person is unaware of. And there's a difference between being unaware, them feeling, responsible and wanting to improve versus someone who really doesn't care. So there are two dichotomies to that. And I don't think we can put everybody in the write you off cancel culture, because that's not really fair. And some of it is generational. Some of it goes back to race and gender and other forms of inequity. And so how do we use those teachable moments? And then at what point do we cross that line and say, okay, we're done? So we'll talk about that in a minute as well. We have to communicate what we want. And this is really hard because part of why we don't communicate what we want is that we don't want to seem aggressive. We don't want to fit that box where we become that aggressive woman at the table. But I will tell you that having gone through some pay equity issues myself, I realized in talking with one of my leaders, who I report to, I was sharing kind of where I was in my career process last year, where I thought I should be financially in regards to equity. I work for a state system, so salaries are all public domain. Sometimes it's good to know, sometimes it's not, but in this case, it was good to know. And I was asking for advice of how I really take those next steps. And what I learned was he had said to me, you know what, I've never actually had to ask for a promotion or a raise. So this is a new conversation for me. And I found that very fascinating because unfortunately, I think many of us, if we don't ask, it will never happen. So how do we get the confidence? What's going to push us forward? And how can we start taking those positive steps? We also need to remember that just because someone's in a powerful position, it doesn't mean they're a good leader. And unfortunately, so many times I think we work in environments where there's lots of powerful people, but how many leaders do you really have? And so you want to build those leadership skills. You want to build yourself as somebody who's invaluable based on your skills and your talents. And that will come to fruition. It may take a little longer, but just remember, power doesn't always equal leadership. The maternal wall of, once children come into the mix, should that slow down your career? If it doesn't, I think you're pretty much Wonder Woman, but it's okay if it slows things down. We do need to address things like more paid leave, whether that be because of children or other family issues that we need to deal with. And then we've talked a lot about kind of our peers and our mentors. So how do we really identify people who are valuable to us, and how do we find those who have time for us? And then fear, as I mentioned earlier, this is a huge barrier for us. Fear in not trying to seem too aggressive, fear in trying not to come off too overly arrogant or overly confident, and really almost feeling like we have to apologize for our success. Whereas maybe your partner is a little bit, yes, they're happy for you, but you know what? They think they're important too, and you're getting all the credit. So how do you balance both at work and at home, being proud of yourself and proud of the things that you've accomplished? And then Me Too, it has a double-edged sword to it, because we know there's a lot of things happening that should not happen and need to be addressed. But are we afraid to bring some of those issues up because of retaliation, or it will prevent us from hitting our career goals? So that's the double-edged sword. Is I'm using #MeToo in this regard as sort of a compilation of harassment. I think this study that recently was published and presented at ASCO in 2021 is a great reference for you if you haven't looked at this. And really the moral of the story I want you to look at is that of the respondents, 80% versus 56% of the respondents that were men experienced sexual harassment, which was identified as gender harassment, unwanted sexual attention, or sexual coercion. So there is a disproportionate number, not only by those in the workplace, but also by patients and families. So I think that this led to really women being saying, I kind of have to hide my personal life. I have to be this person in the box, and they have to change their personality to adjust to their work environment. This is a real challenge, and I think that being able to put some numbers behind this and start taking steps towards resolving this is key, and all of us play a role in making this a better work environment for us and those who are coming after us. So how do we address what's holding us back? As I mentioned, we need to appreciate those generational struggles, but you also have to pivot, because if you don't pivot and you don't embrace technology, you don't embrace sort of improvement, you will become less relevant and eventually potentially extinct. So pivoting is essential. We have to be realistic with our expectations, and we have to reassess those goals. Yes, this is our goal, but do I need to adjust my timeline? Do I need to scope that a little bit smaller and develop kind of that stepwise process? Is it realistic for where I am in my timeline right now. If I have little kids, I'm trying to get my master's in public health and I have a busy clinical practice. How do we balance all of those aspects? How do we evaluate what's important and what's not important and prioritize those goals? You have to have constant check-ins, and whether you use your mentors or your peer mentors to help you with this, it's very essential. And you have to build that circle of trust. I think one of the most important books I was given by one of my mentors, who's actually outside of my field, she gave me Nice Girls Don't Get the Corner Office, which she was a founding partner at a large PR firm. And the nice part about her bringing her expertise into my world is that it was from more of a business and sort of forward-facing environment, but she had lived through many of the struggles of our mentors. And I think it's so important to get different perspectives of how people handle situations and how you see yourself and how you want to grow your career. So as you build your circle of trust, you need those people because they're going to check you, right? They're going to say, hey, you need to slow it down, or hey, you're not pushing yourself enough. You really could do this. And so sometimes those things will work out, sometimes they won't, but you have to have a circle of trust. And sometimes you have to go outside your current circle because that circle's a little too close to home, and that's okay, but build that circle of trust. In addition, things that are more practical related, it would be great if we had more flexible positions and on-site childcare that was more flexible, especially during things like pandemics. But we do know with flexible positions, those don't always translate into leadership positions. So that's where we may have to slow things down to hit our ultimate goals. We know that in order to mitigate some of the bias that we're experiencing in regards to pay, job opportunities, Me Too, we need those annual reviews and have an agenda. A meeting without an agenda should never happen. So when you're going to your review, if your supervisor doesn't have an agenda, you have an agenda. I highlight kind of, here's my bullets of what I'm doing. Here's what's happening. And I always have an agenda when I go in. What are the improvements we're reporting so we don't feel there's retaliation? How do we implement, bias training? How do we actually have consequences for bad actors? How do we have maybe some kind of consensus around enhancing our paid duration if we have to take time off? And then how do you develop better peer and build your team and develop your mentors? That takes time. It takes talking to other people who've done it and have done it effectively. And it takes really thinking outside the box a lot of times. So there is no right answer. Oh, the places you could have gone. Don't get stuck in coulda, woulda, shoulda. Don't get stuck in decisional regret. You have to make the best decision at the time and move forward. Learning from the past is fine, but don't get stuck. Reach out to your circle of trust when you need it, and make sure that as you think about your path and as you make those changes, it's balanced. It keeps your goals and values and integrity at the forefront, and move in a stepwise process towards those goals. So in closing, oh, the places you will go, you're off to great places. Today is your day. Your mountain is waiting, so get on your way. Reassess your goals regularly. Be honest and prioritize. Find a mentor and peer support. Reestablish and establish those realistic timelines. Learn from a history, but don't get stuck. Address your fears and stick with what's really important to you and your situation. So here's a few additional resources. I did also include a little bit from Brene Brown, who I also find is a PhD in social work. This has been some of the greatest inspiration that I found from Daring Greatly and Daring to Lead, especially dealing with vulnerability. And then ASCO or ONS have leadership development programs. So in closing, I want to thank you all for your time. I want to wish you well, and you will succeed. Yes, you will, indeed. 98 3/4% guaranteed. Kid, you'll move mountains. So thank you for your time, and please let me know if you have any questions.